The National Primary Healthcare Development Agency in Nigeria has been at the forefront of transformative initiative aimed at fortifying the country's primary healthcare centers through the implementation of basic healthcare provision funds. The agency is spearheading an initiative to enhance the quality and accessibility of healthcare services for Nigerians. This initiative not only addresses immediate healthcare needs, but also holds the potential to bring about long-term positive impacts on the overall health sector for the Nigerian economy. Now, what more do we have to know about the activities of the agency? Let's get talking now, and I'm being joined by the Executive Director, Chief Executive Officer of the National Primary Healthcare Development Agency, Dr. Mui Aino, live from our Abuja studios. Dr. Aino, good afternoon, and thank you for joining the program.
Good afternoon to Lulupe, and thank you for having me.
Great. Let's start with your scorecard. Of course, a lot will be on the forefront for you since you assumed the office as the ED. How has it been? What should we be looking forward to?
Thank you very much, Tolulope. As you are probably aware, I've been executive director for just over 5 months now. And one of the first things that we did was really to develop a vision and a strategy, what identify our priorities that we want to focus on. And really feeding into that was a couple of important guidance frameworks. So one of them is the health sector strategic blueprint that the coordinating Minister for Health and Social Welfare and the Minister of State for Health, Professor Mohamed Ali Pate and Dr. Tunji Alausa had developed even before we started. I think it articulated what the overall health sector priority should be. Of course, the primary healthcare system is within that. But also, later in December, which was soon after I joined, this was, I think, December 12th, Mr. President launched the Nigeria Health Sector Renewal Investment Initiative, which was really a program that pulls together all of the actors, including the federal government, the state governments, the development partners, and the communities, many of the stakeholders, to really agree on a set of priorities that the president seeks to deliver for Nigerians. So putting all of that together, we went through a listening process and really assessed the state of PHC and came up with a strategic blueprint for the primary healthcare system that focuses on a number of things. One of it is really, I think at the top of it is really having a program that delivers equitable and quality primary health care services to every Nigerian. So wherever you are, whoever you are, as long as you are in Nigeria, you can walk into a primary health center and get access to the basic services you need. Of course, we are doing this in partnership with our sister organization, the National Health Insurance Authority, who's responsible for financial protection for people as they go and access services in the PHCs. So there are a number of things that are articulated under that, but I wouldn't dwell on that. I will dwell on some of the things that we have done. So soon after in fact, right after we started, we introduced a new vaccine to the Nigerian primary healthcare, the routine immunization program, which is the human papillomavirus vaccine. HPV vaccine is a very safe and effective vaccine that prevents cervical cancer. Every year, there are 12,000 cases in Nigeria and 8,000 of our women die from that. So we're very lucky that President Bola Ahmed Tinubu approved the introduction of the vaccine, and we introduced it under the leadership of the Federal Ministry of Health. And in the first wave states, 15 states and the FCT, we've been able to vaccinate 4.9 women, which is not a trivial number, given that that's very close to the target that we set anyways. So we did an initial campaign, and then we are now, we have routinized it. So if you go to the PHCs now, you can get human papillomavirus vaccine for our girls, and I encourage everybody to go out and get them. The second phase of that will be commencing in May, where we're going to the rest of the 21 or so states that have not introduced it, and we hope to reach another 6 million girls. We have taken, I think the vaccines are coming in country pretty shortly. We are doing all of the preparatory work, the training, the advocacy, and the communication, education of the population that needs to go into that. One of the other things that we have also done is that we came in, there was a diphtheria outbreak that was raging at the time. 6 states, 62 local governments, people were dying. We responded very quickly and vaccinated hundreds of thousands of children very quickly. Each location, you get 3 rounds of the pentavalent vaccine. We've done 3 rounds in 56 of the 62 local governments. 6 more are awaiting the 3rd round, but the outbreak has since abated. Again, I think we can have more conversation about why some of the outbreaks are happening to start with. I think one of the other things that we have achieved so far is the training of health workers. Today, in fact, we started the process for lead training 120,000 frontline health workers, meaning nurses, midwives, community health workers who work in the primary health centers across this country. Many of them require refresher training to be up to date in integrated primary health care content, such that they are able to attend to the whole person when you go to the PHC. One of the challenges at the point of the PHC is that we don't have many staff. They're stretched, so you don't have specialists in different conditions. So it's important that our hardworking frontline workers are able to attend to all of the different conditions. I think for the Basic Healthcare Provision Fund as well, last week at the Ministerial Oversight Committee, and I should probably, if you permit me, correct something that you said in the beginning, which is that the Basic Healthcare Provision Fund is a program of the NPHCDA. I think it is a federal government, a Nigerian government intervention program. The National Primary Healthcare Development Agency is an important part of that, but it is not all of it. It is funding from the government that goes through 4 gateways to the states to implement primary healthcare services. One of the gateways is the National Primary Healthcare Development Agency, but we also have the National Health Insurance Authority, we have the National Center for Disease Control, and we have the National Emergency Transport System that also have some of the resources going through them. For the funds that goes through NPHCDA, it goes to the states for service readiness. So what they do is, we working with them with our approval, they send the money to health facilities through what is called DFF, the Direct Facility Financing, which gives them operational funds to run the facilities, to buy some commodities, buy fuel for their generators, hire ad hoc staff, keep the facility open and clean, you know, things like that, that you need that the facilities did not hitherto have. Part of the resources also goes to dedicated human resource hiring, you know, hiring midwives and skilled bath attendants in many of the states. So last week, the Ministerial Oversight Committee, which is the group headed by the Coordinating Minister for Health that oversees the Basic Healthcare Provision Fund, approved the release of 25.8 billion to be split across the 4 gateways, but most of it will come through the NPHCDA and the National Health Insurance Authority gateways to go on to the state. Let me pause here and to take your next question.
Brilliant. Let's now look at the focus on the Basic Healthcare Provision Fund. You've touched on that. I think about 25 billion has been disbursed now, according to the minister. But tell us, how will this strengthen primary healthcare centers nationwide?
So I think that, you know, like I said, the Basic Healthcare Provision Fund goes through different channels to do different things. I will focus on 2 of them. For the National Primary Healthcare Development Agency, what the BONI does is, you know, we work with the states to identify facilities that are providing services. We give them money. They then supervise. Remember that delivery of primary health care services is actually the responsibility of the states. But the National Primary Healthcare Development Agency provides technical support, resource mobilization and coordination, and basically human resources development and, you know, policy and implementation to guide and support the states. So the states are primarily responsible. So we implement through them. So we give them the money, and then they send the money to their facilities for what we call service readiness, meaning it makes the facilities ready to provide the services, the inputs that they need, you know. Some of the commodities, like I said, some of the ad hoc staffing, some of the utilities, providing water, keeping on the lights, keeping the facility clean, and things like that. So it's important, and health medicines, that they need, the injections that they need. It's important that the facilities have that for Nigerians to be able to walk in and provide access the services that they require. I think there is a second gateway, which is, I should mention, which is the National Health Insurance Authority. So it's one thing for people to go into a facility and the facility is able to provide services, but it's another thing for you to not have to pay out of pocket. And that's the responsibility. That's what the other gateway is really attending to, so that it protects the poorest Nigerians from the financial pain that comes from having to pay for health services when you go into the primary health centers. So these are the major ways that the BHCPF goes to enhance services. I think one of the things that we also are doing is that the BHCPF has been very impactful. It's been, it was set up by the National Health Act of 2014, but really kicked off, I believe, in 2019. And it's had impact. 8,306 primary health centers nationally currently get money every quarter, which is money they didn't have before, which I'm sure a lot of Nigerians can already see the impact in many of these facilities. However, we did identify gaps in the way it is being implemented, which is, things around transparency and accountability in some areas, especially when you go downstream to the health facilities. So we are working very closely with development partners, with the states, to reform both the NPHCDA and the NHIA gateways to identify opportunities to close the gaps and make sure that the money is spent well. Thank you.
Well, let's now look at the transparency framework, the involvement of the likes of EFCC, ICPC, tracking expenditure, and the outlook at the end. What comes up at the end of the day is what Nigerians want to see. So how do we see transparency and accountability in all of this?
It's very interesting that question is coming up a lot, but I think it's an important component of what we are trying to do. One of the tenets of the strategy of the coordinating minister, but also of the Primary Healthcare Development Agency, is transparency and accountability to Nigerians, to the things that we have promised and committed to, and even the president will hold us all accountable for that. So it's a very important question. So there are a number of ways that we are trying to ensure transparency. Again, what used to happen before was that there was a lot of trust in the system. You send money to the states, they send to the facilities, and it was difficult to really track in a real way where the facilities were spending the money. And trusting that they would spend it on the right things, we did find, and the Auditor General actually did some work and released a report that found that the money didn't always go to where it needed to go. So we're doing a number of things differently now. Some of them are in the immediate, to make sure that this 25.8 billion, when it's released, we maximize value from it. It doesn't go to waste or get misused. But there are other medium to longer term interventions that we are hoping to put in place before July, when we launch the reformed basic healthcare provision program. So we do hope to launch the BHCPF 2.0, is what it has been christened, in July. We're working with partners and all different actors to try to refine those now. So I will break it into the two parts. I think in the near term is, first of all, before we release money to the states, I've met with all of the states, the state health commissioners, the primary healthcare development agencies, and the state health insurance authorities to develop, based on what the Auditor General found, but also based on the gaps that we have identified on a state-by-state basis, remediation plan to say, okay, where there are gaps that allow leakages in the resources through your state, these are the specific things you need to do about it. You need to have a dedicated account. You need to block the opportunity to spend the money. You need to do this report periodically. You have to have an internal audit, do these types of processes, those kinds of things. So before the resources goes out, we're making sure that the states have either done those actions that are immediate and are due, or have commenced the ones that take a bit more time. That's one intervention there. The other thing that we're also doing is we're hiring what we call social accountability officers who will monitor the performance and financial management at the health facilities to say, look, are the funds being spent on the things they should do? Are the services being provided the way they should be provided? They will be outside of government. They will be independent. So they are going to be reporting to us and giving us information since we cannot physically be everywhere. The other thing that we're also doing is we've engaged with the civil society to say, look, you are in the community, CSOs are in the communities, they should engage with the health facilities and feed us back. We're also asking citizens to pay attention to the health facilities. The minister has opened a whistleblower line, a phone line and an email address where when people see things that are untoward going on, that have questions, they can let us know and we will take action. So we are having conversations with anti-corruption enforcement agencies, the EFCC, the ICPC, like you said, so that, first we want to get their advice on how to think about some of these reforms, but also as we're implementing them, is to really bring them on where there are issues of misuse of the funds so that they can help take action. It's not the remit of MPHCDA to pursue individuals who have misused government funds, but there are agencies that are much better equipped and backed by law to do that. So that's why we are bringing them in. In the longer term, we are using technology as well to create end-to-end visibility and real-time reporting, such that from the Ministerial Oversight Committee, the Federal Ministry of Health, through the gateways to the states, to the facilities, you can see how much money has been transferred and how much money is sitting where. But also being able to track expenses electronically, at the health facility level, so that you don't have to, if a facility says I spend the money on X, it's very easy to validate from the electronic transactions that that's where the money went to, as against now where a chunk of the money is taking out cash and you just have to believe the reports that people gave that this is what they used the money to. In addition, the minister has also mandated that we create a lot of visibility and engage with Nigerians. So we're going to be sharing information. The funds that have been released last week, the information will be put out, how much is going to which state and for what, so that Nigerians know. And they can feed us back, and they can also track and hold the states responsible as well. So these are some of the changes that we are making. We hope that with all of this, there should be a bit more accountability and transparency with the use of the basic healthcare provision funds.
All right, our time is fast spent, but in 2 minutes, if we can do this, I'd like you to talk about the challenges and efforts to strengthen the expanded midwife service delivery and your assessments, your nationwide assessment of the state of PHCs.
Very quickly, thank you. So the expanded midwifery service scheme is a special intervention by the federal government. Again, remember that the hiring of midwives and health workers and the running of health facilities is really the remit of the states and local governments. In many states, it's the states now because of the what we call primary health care under one roof. But we identified significant gaps in human resources. So while the states ramp up their capacity and staff strength, the federal government decided to intervene and hired over 2,000 midwives and thousands of other cadres of health workers to deploy to the states. Of course, when you are here in Abuja and you are managing health workers in the field across the country, that cannot be without challenges. We're working with the states, but and I think that's had a lot of impact, because if you look at the facilities where these midwives have been deployed and those that they have not been deployed, there are actually differences in service utilization. But there have been process challenges. So the verification of the services rendered, to pay them, you have to check who has gone to work and who has not gone to work. That process is continuing to be evolved. When I came on board, there was a backlog of salaries of 4 or 5 months, but we were able to, thankfully, work with the the minister and other stakeholders to mobilize the resources to clear up the backlog. This quarter, we're also right in the process right now of clearing any backlogs that have accumulated this year. But in the long run, the hope will be to work with the states to have a sustainable way to transition this to the states. We also have resources that we're mobilizing by the way to expand the program, because in the immediate term, we need to have more health workers in the field. On the health facility assessment, one of the things we also found is that, the state of many of our primary health centers is not where they need to be in terms of functionality. So we're doing an assessment quickly nationwide to see the 8,300 that are basic healthcare provision fund our facilities now. How do we prioritize investments to get them to pass so that people can go and receive services in a dignified way? But also, as we think about growing that number, I'm sure you are aware that the plan over the next 2 to 3 years is to expand the number of facilities that will be receiving these the basic healthcare provision funds to 17,600 or thereabouts. So we want to be intelligent in the way we do that. So after the one per ward that the government has promised that we will deliver, God helping us, we want to use evidence based on accessibility, distance, disease burden, population, to add on the extra ones so that not every ward requires as many facilities as the other ward. Because if the goal is to save lives and provide access to basic healthcare, you want to go to where the need is. So that's the essence of the baseline assessment that we're doing. Right now, we have completed the exercise in 24 states last week, and the remaining states will be in the phase 2, which will be right after the Yuletide period that we're in now, just to allow our staff and assessors to spend time with their families as well. Thank you.
Amos, thank you so much, Dr. Muya. I know we'll keep a tab on this, monitoring and evaluation, and we hope to have you in to talk to us more about this. Thank you, CEO, Executive Director, National Primary Healthcare Development Agency, Dr. Muya.
Thank you very much, Tolulope.